So my name's Laura Roughan and I'm a consultant clinical psychologist in the CAMS service. And today I'm here talking about tics and Tourette's syndrome. So one thing I wanted to say is that during lockdown, there have been lots of young people who've presented with more tics or maybe didn't have tics before. So one thing we've been doing in CAMS is doing a little psychoeducation group for young people that we've done once and we're running again soon. So this is kind of a modified version so that we can teach parents about tics as well. So today, let me put it on slideshow, sorry. There we go. So today I'm going to talk a little bit about understanding and treating tics and Tourette's syndrome. So we're going to talk about what are tics, what causes tics, sort of how to manage them and sort of living with them. So a bit about our tics talk. So tics seem to be increasing in young people. So this can be because of stress, it can be because of kind of seeing other people ticking, lots of reasons. We're going to talk about that a bit today. Medication is not always the answer. So understanding your tics and learning to manage them is also really important. So lots of people say, well, my child's got tics, I'd like some medication for that. Medication is one thing that can help, but it doesn't get rid of them. It doesn't make them disappear. And actually it's about living with them and working out how to do that. And we'll think today about different treatments as well. So just a quick round of interesting facts. So did you know that tics, they can vary, they can change, they can start early. So lots of people get them between kind of 5 and 10 years old. They don't affect intelligence. We think they might be genetic. So what we also know is they often come, you don't often have tics on their own. They're often part of a neurodevelopmental disorder presentation as well. So they seem to be more common in people with ADHD and autism. Having Tourette's doesn't mean that you just swear and always swear. So what are tics? So tics are repetitive movements or sounds that we make happen without much of a warning. So some people can hold them in for a while, but this can be difficult to do for long periods of time. So you get young people that can kind of manage them and not use them so much, do them so much in the day. And then you get, sometimes people get an urge, so sort of feeling that they're going to have one, but then they still can't stop it. Tics can occur in any part of the body. The urge to tic is a bit like the urge to sneeze or cough or blink. So it's kind of, you can't stop it, you can't change it, it's just there. And tics can be simple, so that's like one movement or one sound, or they can be complex, so having lots of movements and sounds. So we've got different kinds of tic disorders. So there's a transient tic disorder, which is one or more motor or vocal tic for less than 1 year. So they say about 15 and 100 people have this. So this might be that you have a mouth stretch movement and you do that, and that would be called just a tic, really. Chronic tic disorder is one or more motor or vocal tics that would last for more than a year. So this is just having a tic that you have for a long, long time. And then the difference between tics and Tourette's is that Tourette's is at least one or more motor and vocal tic that would last more than a year. So this is where people are making sounds, so coughings, making noises, swearing, clearing throat, and motor movements, so ticking in their face, stretching, blinking, moving arms, legs, and usually Tourette's syndrome would have a combination of a lot of those different tics coming along. We think that tic disorders affect more boys than girls, and that's still the case at the moment. So what causes tics? So tics can be caused by the way your brain is wired. So people with tics tend to have less control over their movements. Lots of people with tics may also have family members with tics, so that's where the sort of genetic side of it comes in. And scientists are still trying to really figure out what exactly causes them. So we know, I have a very complicated picture of the brain here, but we know that the region of the brain called the basal ganglia is involved in Tourette syndrome. And so that is the part of the brain that sits right at the back of your brain, and it's responsible for movement. So I guess there's something within that part of the brain that means that the movement is more intense and less controlled. So what happens to your tics as you get older? So for some people, their tics will get worse around the age of 13 and then reduce. So they often start around 5, and it's kind of early teens is when they're probably worse. And then they kind of usually disappear or get better as you get older. So you can see, I don't know if these graphs quite make sense, but the first one, the tics, is that it's showing that they don't really exist before the age of 5. They get worse between sort of 10 and 13, and then they sort of disappear as you get older. Whereas you can see something, so hyperkinetic disorder, that's ADHD, you tend to notice it around 3-4 years old, and it kind of stays the same all the way through. And things like obsessive compulsive disorder, again, you can usually see that quite early on, but then it sort of isn't around early primary school age, but is more difficult adolescence and adult age. So that's just comparing the kind of longevity of it. So, so for some people with tics, they'll stay the same over time, and there's not an age when their tics are worse. But for most people, it's between the age of 3 and 9. Tics generally peak around 10 to 13, and then they decrease following this. So for 1 in every 3 people with Tourette syndrome, tics will get better as they grow into adulthood. They tend to wax and wane, and this means that sometimes there are times when they're higher. So I think saying at the beginning about how children have just gone back to school and the tics seem to have got worse. And then there'll be times when they decrease, so maybe when they're more relaxed. Or you get the opposite as well. You often get children and young people that hold them in all day, but then come back after school and they tic a lot all evening. So what else is going on? So I sometimes use this idea of an iceberg to show this is what you see. So you see the vocal tics, you see the motor tics, but what else is going on underneath that? So I think I've already mentioned that things like ADHD, so difficulties concentrating and organising yourself, is quite common part of having tics. ASD as well, so autism. So this is finding it difficult to get on with people. This is also a very common diagnosis alongside tics. And then stress and anxiety. So we're seeing increases in stress and increases in tics in lockdown. And we think that's probably related to young people being more worried about things. There's also a link between TikTok and tics, suggesting that people are sort of watching other people ticking and then kind of catching it almost, which we have heard of before. So I'm not going to show this video, but I can send the slides after so people can have access to it. But it's just a child talking about their experiences. So what are the triggers? So triggers of tics are things that set off your tics. So some tics will only happen in certain places and situations. Some young people talk about how if they think about certain things, it will trigger their tics. And it can also, what we've found is it's really useful to learn which things trigger your tics, because that helps you to then work out how to manage them. So I think school can be a trigger, stress can be a trigger. Sometimes people talk about not having enough sleep as a trigger, or going to bed as a trigger. So it's often quite useful to sort of work out what the pattern is, when they're worse, what makes them worse, because that helps you to understand them. So, here's some more possible triggers. So sometimes it's TV and video games, doing homework, certain smells, sounds, feeling looked at or judged, being hot or cold, feeling unwell. Interestingly, one of the triggers is often when people tell you to stop ticking. So you often meet parents that say, I just want them to stop. And I tell them to stop all the time, but it gets worse. And that's because you're almost drawing attention to them and making them more conscious about them, and then they tick more. So one of the things that we would do around managing tics is, first of all, to gain that self-awareness of tics. So tic awareness training teaches the children how to self-monitor early signs of tics and to recognize what they call the premonitory urge. So young people talk about when they have a tic almost like a feeling they get before. So sometimes they talk about like a hot feeling that comes up their body and then they tic, or an itch, or a feeling like you're going to sneeze in part of your body and then it moves. So by self-monitoring, you start to work out when it's going to happen, and that means you can have a bit of control over it. So we would get young people to think about how often they're happening, how intense they are, how much control they have over them, thinking about what it feels like before you tic. Because often young people will say, oh, I just don't know when I'm doing it. But when you start to look into it, they can kind of understand a lot of the time when they are coming. So we might just use some monitoring diaries like this. So a simple one might be for the young person to pick a time, so sometimes like a 15-minute slot, and tally up how many times they tic in that time, what they notice, what the feeling's like. Sometimes people use those little tic counters, like little counters that you tick it every time it happens. Similarly, parents can monitor tics for young people, so they can watch them while they're doing an activity or having dinner and keep a note of what tics are going on and when they're happening. And that just helps to get an idea of when they're happening and how much they're happening and what the tics are. And I'll talk a bit more about that as we go through. So in terms of treatments, there's not really a specific treatment for tics or Tourette's. But there's certain aspects that can benefit from a treatment. So I think the important thing is no treatment completely takes the tics away, because I think sometimes people think, oh, if I get medication, they'll go away. And it doesn't work that way. It sometimes calms them down, but it doesn't sort of take them away completely. So as a psychologist, we often think about how can we live with these? How can we understand them? And how can we work out a way to kind of accept them? So often it's thinking about how actually, if we were to think about ADHD and autism, we'd think about a young person's strengths that brings. So somebody with autism might be really organized or really determined or know lots of information about a certain subject. And somebody with ADHD might be fast and enthusiastic and really good at sports. So with tics, we think about what is it that that this is something that's a special part and a unique part of the child, and we have to work on how to accept them. So thinking about what strengths it might bring for them, or what other strengths they have that they can build on as well. So some little tips about what could help just in general at home. So lots of research into what helps tics, and actually focusing. So concentrating on something else can sometimes stop the tics. So I think I've done something with a young person before. We have those kind of mindful colouring books. And actually, if they're really concentrating on that, not trying to go over the lines, picking the colours, their tics actually get better during that activity because they're focusing so much on something else. And so while you can't spend your life colouring, it's about building that skill of how they can learn to focus on something else, which means the tics get less. While doing that, they can then learn how to manage that. So learn, when do I need to not tic as much? So for example, I might not want to tic if I've got an interview, and what can I focus on and how can I work out how to keep the tics at bay, and then have other times when it's time to just let them go. The other thing that is meant to be really helpful is being active. So physical activity can reduce the tics for a while. So if you think about it being to do with movement and muscles, actually by using the muscles, you're getting a lot of movement out of them, and it may stop the tics happening as much at other times. It also promotes kind of relaxation and healthy living and things like that. So all those sort of things are positively correlated with less tics. Planning ahead. So, and I think this is thinking about, once you've worked out what triggers are and when they're happening and when they're worse, it's about planning ahead for the possible times that you will tic and thinking about times that you won't tic. So I don't know, if you get really anxious going to busy places and you're going to go somewhere like a concert or a cinema or something, and you know you're going to tic a lot, what can you do to support relaxation in that setting? Or how are you going to make sure that you don't, choosing somewhere to go that means that if you were to tic lots, it doesn't matter. So I suppose the cinema for a really quiet film might be quite challenging to sit through if you've got lots of verbal tics. But I expect there's lots of performances that you can go to. I know they have special performances for children with autism and children with SEN needs, and it might be going to one of those, they feel more accepted and it's okay to tic. So it's planning ahead and thinking about how to, I suppose, compensate for the problems rather than get rid of them. And then school. So talking about with your school about how they can support the young person and what maybe they might find helpful. So it might be that they can hold it together for sort of 40 minutes, but actually then they need 10 minutes of ticking and they want to go somewhere away from other pupils to do that. Or it might be that sitting in a certain place in the classroom means that they feel less conscious of them. And that could be a simple thing that schools could do just to make them feel a bit better. Relaxation. So this is an interesting one because sometimes it can really help tics, but also it can increase them. So we often hear about young people that have gone to school and manage them fairly well all day and then come back and they're really, really bad. And that's because they're more relaxed at home and they're more able to let them out. I've had mixed experiences, and I think it's about young people trying out things and seeing what works and what doesn't work. So I remember working with a girl that if you did like a relaxation thing where you're sort of calm and like a visual kind of story of, oh, I'm at a beach and it's really calm here, then she would tic a lot and get really uncomfortable. But actually doing a very brief kind of breathing exercise really helped relax her, and then she didn't tic so much. So it's kind of thinking about what works for the young person. There's no right or wrong answer there. And we know that stress is often a trigger for tics. So sort of general relaxation can often reduce them. But as we know, relaxation means different things to different people. So it might be that playing a computer game makes them feel relaxed and they tic less. It might be running or playing sport or doing some colouring or lots of different things. So it's exploring, I suppose it's exploring relaxation, fun activities that help manage them. So I've talked a lot about lots of these things already, but we'll just go through some of the treatments. So one of the treatments you may have heard of is something called habit reversal training. And this is kind of a sort of CBT type approach, which is cognitive behavior therapy. So it thinks about how increasing your awareness to the tic and then practicing a different behavior and thinking about changing the urge. So it kind of thinks about how your thoughts and feelings can affect the situation. So it's again, it has a lot at the beginning of the treatment around monitoring, around thinking about how your mood affects tics, how activities affect tics, and when they occur. I think there's a myth that people think that habit reversal training can cure tics, and that's really not true. When I've used it where it's been successful is when a young person has like a really severe tic that's maybe causing them pain. So I had a young boy that used to punch himself in the chest really quite hard, and that was a tic. And everybody was very worried because he was getting a bruise and it was hurting. And so we used the habit reversal training to kind of reverse that tic. So it didn't get rid of it. It stopped him punching himself and made him we changed the urge from, it's hard to explain, but instead of doing that motion, he did that motion. So he was pushing down. And by practicing that change in behavior and by recognizing the urge first and then pulling, like basically strengthening his muscles and pulling his arm the other way, he was able to change that tic so it didn't hurt anymore. So it's not very good for tics where you've just got a few facial kind of movements because there's not much you can do with those. And it's no good if you can't recognize when it's coming. So it's all about that urge, recognizing the urge and then trying to do something different. And as I say, it doesn't make the tics disappear. It makes you change them so that perhaps they don't hurt anymore or they're not so impairing or obvious. But you still have a tic, you just redirect it somewhere else. So that's a bit about habit reversal training. So the exposure response prevention is kind of learning to suppress the tic. So again, it's having that urge and tolerating that urge and allowing it to just kind of disappear. So if you think of a sneeze, you know, when you have a sneeze and you can feel it coming and then you really don't want to sneeze wherever you are. And so you manage it, and then it disappears. So that's that kind of approach. So again, it's not going to get rid of them, but it might stop the most impairing ones when you really don't want them to happen. And then the functional behavior analysis is kind of more thinking about monitoring again. So discussing where they happen, why they happen, thinking about building in time into your day to go away and tic, because that might make it less at other times. So it's really kind of understanding when they happen. And then the medication part, I think what I put here is that sometimes it can help relieve the sort of larger, more disruptive tics. So again, it's not going to make the tics go away. It's where they're really impairing. So I've met young people that, you know, their tics so strong that they fall off chairs and that they bang into things and they're hitting themselves, really hurting themselves. Sometimes the medication can just dull that down a little bit. So what I would say about things like habit reversal and exposure response prevention is they are really hard work. So a young person has to be really motivated to want them to change. I think it's usually best if there's some sort of pain element or something really difficult about what they do to change that. And as far as I'm aware, I don't think it changes what comes out your mouth. So if you're swearing or saying things, I think you could maybe work on that urge, but you might not change what comes out. So it's thinking about not every strategy works for every person. Try a range of different things to see what helps, because you never know unless you try. So lots of young people say, oh, relaxation doesn't work for me. But relaxation, as I said, means a lot of different things. And it could be that some things work and some things don't. And I think that being able to live with tics and understand why they happen and explaining them to others can be really helpful. Because if you think of sort of, well, maybe you're, I don't know, new to a club or something and you're ticking a lot, people are going to stare, people are going to wonder what's wrong. Just having a really simple phrase to say, oh, don't worry, I've just got some tics. You know, they're fine. They're not going to hurt anybody, or, you know, just something that they can say that they feel quite confident saying, so that people recognize that there's something different and then don't feel scared of them. So we'll move on just to think a little bit about the future of tics. So I think I've said some of this already. They change as they get older. They're usually worse around sort of ages of 10 and 11. And they tend to change depending on stress and what you're doing and activities and things. I think the other thing to say is a third of young people that have tics won't have them into adulthood. Another third would have them a lot less severe, and a third would go on to continue having them. So you might have Tourette's as a 13-year-old. So if you had 3 people with Tourette's at 13, one would not have any tics by adulthood, one would be a lot less severe, and one would continue to have it. So that's the kind of statistics on it. I think one of the things I often see with young people and parents is actually the young people have kind of accepted them, and sort of by the time they get to CAMS or somewhere where they want some help for them, the young people are usually not that fussed about them unless they're hurting them. They're generally okay with them. It's often the parents that think, oh my goodness, I want my child to stop doing this. I want something to help them. I want to get rid of them. And actually, the young people are not so bothered. So trying not to worry about them, and trying not to let the tics stop anything happening. So stop you going to school or stop going to activities or events, is probably the best approach. And I think thinking about young people, they should be able to go anywhere, they should be able to do whatever they like, not miss out on life because of tics. So you often get young people who have said, oh, I was picked on at school, so I don't go to school anymore. Or I don't like going to busy places because people stare at me. And we really want young people not to feel so impaired by them. Also, tics don't affect learning or intelligence. There's no reason that a young person wouldn't be able to go to college or university if they've just got tics. And they shouldn't stop you from getting a job in the future. Again, I've got another video here that you can watch in your own time. And another video. So this is just something about tics. This is just something about the future of tics, and just thinking about who else has tics. So there's lots of famous people that have gone on to, that had tics when they were younger and have gone on to be really successful. So apparently Mozart had tics. David Beckham, who's a footballer, another footballer down there, I think is that Billie Eilish, some singer. I'm not sure who all these people are, but famous people. I think this was the actor down here in the corner. I can't remember his name. So I think it doesn't mean that you can't carry on living having tics and things. So I think that might be the end. So I've just got some helpful information here that I'll send around as well. So some books, some websites and things, and some books about explaining it to children. And I think some of them are really good at helping young people to then know how to explain it to other people. The end.